Air is very vital for the process of respiration of all living things on Earth. We breathe as we walk, run, exercise, and even when we are at rest or sleeping. We need air in everything that we do. But there are instances where some people experience difficulties in breathing due to some health conditions.
Hey guys, this is Sofia, and in this video, we are going to talk about CPAP, or the continuous positive airway pressure, and how does it help those people who experience respiratory distress. And without further ado, let us begin with identifying what does CPAP mean. CPAP is a continuous pressure that is being delivered throughout both the inspiratory and expiratory phase of breathing. It is a non-invasive treatment method intended for patients who have respiratory distress or difficulties in breathing but are still able to maintain their own airway, because although CPAP is effective for patients with respiratory distress, it will not breathe for them and therefore should not be used for unconscious patients or patients with altered mental status. According to Health Ed Solutions, it reduces respiratory pump, reduces preload, drops blood pressure, helps compress vena cava, and helps improve preload. According to resleep.com, it helps decrease elevated blood pressure, helps improve cardiovascular disease outcomes, and reduce the risk of cardiovascular fatal and non-fatal events. CPAP was mainly used for patients who have obstructive sleep apnea. And if you are not familiar about obstructive sleep apnea, it is a common sleep-related breathing disorder among several other types. It causes someone to repeatedly stop and start breathing while sleeping. Snoring is a noticeable sign of obstructive sleep apnea. Here is an animation that will show you what sleep apnea is and how it affects a person.
When sleeping, it is normal for the muscles in the mouth, tongue, and the pharynx to relax slightly but not enough to block the airway. In people who have obstructive sleep apnea, the muscles of their mouth and pharynx relax too much that the tongue drops on the tissue of the roof of the mouth, pressing and covering against the back of their throat, causing completely to block the airflow into their lungs. The lack of oxygen in their lungs causes them to wake up.
But did you know that CPAP is also indicated for patients whose oxygen demand has exceeded their ability to compensate for the lack of oxygen? There are studies that prove how it is extremely helpful also for people who have fluid in their lungs, such as pulmonary edema, COPD, and acute bronchospasm such as asthma. Other reasons people may need CPAP include toxic inhalation, drowning, flail chest, and various lung infections such as pneumonia. However, it is important to follow protocols on when to use CPAP. In this picture, you can see a mask that fits over the nose and the mouth. During inhalation, CPAP machine gently blows air through the tube and the mask into the nose, mouth, and throat. Air presses on the walls of the airway, keeping it open, and this prevents airway collapse. During exhalation, the CPAP machine continues to gently blow air to keep the airway open. The continuous airflow also pushes the exhaled air and carbon dioxide out through the holes in the mask. This process automatically repeats with each breath, allowing you to breathe uninterrupted during sleep. CPAP devices deliver a flow of air to the upper airway via a mask that seals the nose and the mouth to create a positive airway pressure. And this positive pressure provides a splint in the airway to prevent it from collapsing during sleep. More to that, CPAP has been recognized as important in the management of COVID-19 patients and was advised by NHS England early in the pandemic. That is the power of CPAP intervention. Amazing, right? And that's it for my Genius Hour presentation. I hope you guys learned something, and always remember to live healthy,